You are welcome, sir. My name is Dr. Taiwo Latif Sheikh. I'm the Medical Director of Federal Neuro-Psychiatric Hospital, Kaduna. The Chairman of the Federal Neuro-Psychiatric Hospital, Kaduna, would like to welcome the Honorable Minister.
Excellency, the Deputy Governor of Kaduna State, Ambassador Nobajoga, Honorable Minister of Information, all other protocols. Honorable Minister, sir, on behalf of the board, management, and entire staff of Federal Neuro-Psychiatric Hospital, I have the honor to welcome you to Kaduna State, and specifically the Federal Neuro-Psychiatric Hospital, Kaduna. I was appointed the board chairman in 2009 to 2011 and reappointed in 2013. The present medical director, Dr. T.L. Sheikh, was appointed in the year 2010, and I have enjoyed productive and tremendous working relationship with him. All the projects that you are going to inspect were conceived and executed during the short period that he has served. In line with the transformation agenda, availability of power and internet services, the hospital has in no doubt found a place among mental health institutions of high class in Nigeria and the West African region. The hospital was established in 1975 by the then government of North Central State as a mental health institution and School of Psychiatric Nursing. The federal government of Nigeria took over the hospital in 1996, and it became Federal Neuro-Psychiatric Hospital with 3 core mandates. 1, provision of specialized mental health services. 2, training of mental health care professionals. 3, research in mental health related field. The Federal Neuro-Psychiatric Hospital hence inherited 100% staff of the state hospital and the infrastructure. The facility included 2 wards, an outpatient department, a block of 2 classrooms, a student's hostel, and 4 bedroom bungalows that serve as staff quarters. By 2010, the only additional infrastructure were a general house, a library, and ECT suite. A ward built and donated by Kaduna State government to serve as drug rehabilitation ward would not be put full use due to structural defects. Honorable Minister, sir, all the projects you are about to inspect were conceived and completed within the period of 2010 to 2013, 3 years. This is intended with the transformation agenda of the present administration. This transformation would have even been greater if the hospital had been adequately funded. I hereby hand over to the medical director of this hospital, Dr. T.L. Sheikh, to further introduce members of the top management committees and conduct you around the hospital to inspect the project, sir. Thank you very much.
In front of you, sir. Yes, sir. We have the female ward that was reconstructed and converted to a modern hospital ward. We have construction of a new male ward, construction of a new female ward, construction of occupational therapy center in which we are seated right now, rehabilitation of the drug ward that was donated by Kaduna State government, construction of child and adolescent ward, which is the only one in northern Nigeria today, construction of a therapeutic daycare center for children with psychological disorders is also the only one available in northern Nigeria today, construction of and equipping of a new medical laboratory, refurbishing of the outpatient department, construction of interlocked walkways between the ward and OPD and medical library, refurbishing of emergency ward, purchase of 15 vehicles, including ambulance, water tanker, and utility vehicles for outreach community psychiatry program. It will please you to note, Honorable Minister, sir, that this hospital is working with Kaduna State government and providing neuropsychiatric services at the general hospitals of Kaduna State in 3 senatorial zones, Benengwari, Kachia, and Ekara. And we are also providing service at Army Reference Hospital, the 44 hospital. We also have item 13, expansion and modernization of the pharmacy. We have constructed 5 boreholes and 4 underground water tank and overhead water storage facilities. There is also construction of 1 kilometer road network, part of which you drove to reach this place. We also purchased and installed 150 kVA generator to complement what we had before. Purchase and installation of anesthetic machines with full monitors for modified ECT delivery as part of the equipment that we installed. Purchase and installation of new electroencephalogram machine to test their brain functioning. This is one of the centers where you can have it done in this part of the country. Construction of a staff lounge and kitchen, installation of computer and workstations in the medical library, provision of wireless internet service within the hospital, installation of computer laboratory in the School of Post-Basic Psychiatric Nursing, and also refurbishing of the classrooms. Sir, we have some ongoing projects from 2012 to date. Construction of the pharmacy block, which you will see, sir. We are presently working on that. The other 3 that I've mentioned here, because of lack of fund, the ongoing has stopped. That is completion of construction of drug ward, rehabilitation of the old mill ward, and the completion of construction of the road and walkways.
So others ongoing. I decided to make this point now because I know that in the last 3 years we have invested heavily in medical care. Not only in teaching hospitals, where we have completely changed the laboratories and modernized diagnostic equipment in many of our teaching hospitals. We have also gone down to federal medical centers to set up cancer screening centers for all forms of cancer in those centers. And we have upgraded many federal medical centers to enable them undertake services that only teaching hospitals used to undertake before for members of the public. The investments that have been made in the medical services of this country have ensured that today a number of the operations that are taking people abroad, medical treatment, can be effectively done in this country. We have asked that the teaching hospitals and some of the medical centers and special hospitals such as this maybe should advertise their services so that Nigerians will know that some of the money you are spending to take flights to India, you really have not only qualified people within the country, but also the facilities. Usually what used to be the problem was absence of reliable facilities, diagnostic equipment for the personnel to use to diagnose and treat some specific and specialized cases. But today, a lot of those things have been done in Nigeria. We went to quite a few hospitals, such as in the University of Benin Teaching Hospital, where we saw a whole infrastructure for bone marrow transplant, which is already operational. And they have undertaken quite a number of operations very successfully, changing the bone marrow of young children who have sickle cell anemia. And they have successfully treated quite a number of cases, in the University Teaching Hospital, Benin. We went to the, I think, Delta State Teaching Hospital, and we saw whole hip, replacement, operations being done there. And today you see a number of people running to India, people running to Egypt, running to Saudi Arabia. They fail to understand that, or maybe they're not aware, but in some places has become a status symbol. I think honestly that a number of the things carrying us outside this country are available in this country today. And I'm happy to hear for the first time we have here in this hospital a brain scan machine, that can tell you the functioning of the brain. And the CMD is just telling us they got this here. And I believe that these investments cumulatively have shown a lot of commitment by this government to Medicare in the country. We still will do more, and this is outside what we have done in primary health care delivery through the MDGs. Because if you go to most places in this country today, working together with state governments, we have been able to establish rural medical centers almost in every electoral ward in Nigeria today, that render basic services to women, antenatal care, treating, some of the basic ailments before you are referred to general hospitals and then maybe specialized hospitals. So a lot of these investments are going on in the country, and unfortunately, somehow, media don't report this. I'm sure if you go to Kaduna State today and you ask the average people on the street, they wouldn't know that these services exist here. And we're undertaking the governance tour to draw attention of the media and the public to some of these basic facilities that government has been able to provide, both at the state, at the local, federal, local, state, and the federal level. So a lot of work is going on, in this country. But unfortunately, what we hear is just raw politics. People are not being carried along. That is why we're embarking on this. Let me, as we go to inspect the projects, congratulate the chairman, Alhaji Yero, and the chief medical director and his staff, because leadership is about innovation. In 3 years, so many projects conceived and implemented, as the chairman has acknowledged. This is what we want to see, that when you have the opportunity, you make your impact, so that the next people coming will improve on what you have done. So let me appreciate the chairman and management. We would like to see only 3 of these projects. Maybe you choose the 3 most important ones, because we have so many places to go. So if you can identify the 3 most...
It records the activity of the brain and picks where there is abnormality in the brain. The functions. Yes, sir. This is a brain center. This hospital is a brain center. So people used to think it's only people who are insane. But any problem that affects the brain that requires a physician's attention, they come to this hospital. So this will pick whatever is wrong in the brain. It will print it out, report to us, and then we'll be able to know how to manage. We do tests for most of the hospitals that are above the Niger here, this EEG test. They refer them to us, we run it for them, and within...
What's the cost of this machine?
This Neuro-Week work that we installed recently cost close to 5 million naira.
So why should it be the only place here for people to have it? I'm not sure it's manpower. It's sometimes absolute nonchalance. This is a basic equipment that should be in every every federal medical center. I'm sure there are teaching hospitals that may have this. I suppose. Yes. I'm sure teaching hospitals have this. But yes, this is
these are brainwaves.
Electrical activity of the brain.
Electromagnetic
electrical
activity in the brain.
We hope if we have adequate funds by 2014, we should be able to complete it.